Good day everyone, welcome to the new topic that is pregnancy-induced hypertension. What is pregnancy-induced hypertension? Most women with hypertension have been identified before pregnancy, that is called essential hypertension, while some of them are only diagnosed during the first antenatal visit during pregnancy, which we call it as a pregnancy-induced hypertension. So what is the definition of pregnancy-induced hypertension, which is in short form we call it as a PIH? Hypertension that occur after 20 weeks of pregnancy in normotensive women with or without proteinuria. Hypertension returns to normal after the puerperium, means after delivery. Blood pressure in pregnancy-induced hypertension with reading 140 to 190 millimeter mercury or more. Okay. Check after rest for 2 times or systolic pressure increase 30 millimeter mercury or diastolic increase 15 millimeter mercury from the baseline level, that is a blood pressure before pregnancy or during the first antenatal visit. Okay. So the diastolic will increase by 15, the systolic will increase by 30 millimeter mercury. Then we can diagnose this mother as a pregnancy-induced hypertension with the blood pressure more than 140, 90 millimeter mercury. So hypertension during pregnancy is divided into two, that is chronic hypertension and also gestational hypertension. Chronic hypertension, it is a condition where the hypertension of high blood pressure above 140/90 millimeter mercury is known before pregnancy or before 20 weeks of gestation and will continue until 6 weeks of birth. Okay. With gestational hypertension is the presence of hypertension without sign of preeclampsia. Diagnosis identified when the mother's blood pressure is 140 over 90 millimeter mercury and it does not decrease even when the mother is resting. For mother with PIH, stress readings were taken twice a week at 20 weeks of gestation, and it was found that pressure was high even though the mother was identified as having normal blood pressure before pregnancy. So increased blood flow to the uterus occurs in normal pregnancy, but not in mother with essential hypertension. The higher the blood pressure, the less blood flow to the uterus. This causes the development and growth of the fetus to be stunted and can lead to the death or loss of the fetus. Pregnancy has an effect on essential hypertension. Among pregnant women, 60% had an increase in blood pressure while 30% had proteinuria. The purpose of the treatment for pregnancy-induced hypertension is to obtain and maintain an adequate blood supply to the uterus, control the blood pressure levels, and prevent the occurrence of proteinuria. Termination of pregnancy if the condition of the real mothers is deteriorating, or if the fetus fails to grow in the quarterfinal stage of the pregnancy. So what is the preventive measures for pregnancy-induced hypertension? Number 1, antenatal care. Number 2, screening of at-risk mothers. Monitor blood pressure, urine protein, and also the weight. Consult an expert. Health education on food, rest, and follow-up. This is the severity-based management. As outpatient management, extend gestation to 38 weeks without compromising maternal health. For hospitalization, that is hospital management, we have to keep the mother rest, hypotension drug therapy, careful observation of maternal and fetal, laboratory research, that is renal function, liver function, coagulation factor, and care of the less salty diet, and also the health education on pregnancy-induced hypertension. For the obstetric management, for mild pregnancy-induced hypertension, termination of pregnancy on 37 weeks by induction of labor or elective cesarean sections. For the severe pregnancy-induced hypertension that can lead to eclampsia expires anytime the situation deteriorates. This is the list of complications for pregnancy-induced hypertension on mother and also on fetus. For mother, there will be an eclampsia, cerebral edema, cardiac failure, renal failure, obstruction, abruption, placenta, liver failure, and also maternal death. For fetus, there will be a complications such as intrauterine growth retardation, intrauterine death, fetal distress while labor, and also preterm baby, and also neonatal asphyxia. So that's all about pregnancy-induced hypertension and its management. Okay, thank you very much.